Good afternoon, everyone, and welcome to the July 21st meeting of the Fairfax Area Commission on Aging. I'm Carolyn Sutterfield, the chair of the commission. I'm going to ask our guests to remain muted and with their cameras turned off for the moment. We're going to conduct some business that the commissioners have to handle in order to comply with the FOIA regulations during this time. So here we go. To conduct this meeting wholly electronically in accord with the emergency procedures authorized by FOIA, the Fairfax Area Commission on Aging needs to establish 3 findings and determinations for the record. This procedure calls for 3 separate motions and votes, which will be a bit cumbersome. I ask for your patience. First, because each member of the Fairfax Area Commission on Aging is participating in this meeting from a separate location, we must verify that a quorum is participating and that each member's voice is audible, clear, and at an appropriate volume for all of the other members. I'm going to conduct a roll call. I will ask each commission member participating to repeat your name, your district, and the location from which you are participating. So please unmute yourself for the purposes of this. Please pay close attention to ensure that you are able to hear each of your colleagues. Following the roll call, we will take a vote to establish that every member can hear every other member. So I will go first and then call on you. I'm Carolyn Sutterfield, representative for the city of Fairfax, calling from my home in the city. Diane, please unmute yourself.
Sorry about that. Diane Watson, representing the Mount Vernon district, and I'm from my home in Lorton, Virginia.
Thank you. Sharon Dreyer.
I'm Sharon Dreyer. I represent the Lee District and I'm calling from my home in Springfield.
Tom Bash.
I'm Tom Bash, representing Springfield District, and I'm calling from my home in Springfield.
Kathy Cole.
I'm Kathy Cole. I'm the commissioner at large, and I'm calling from New Jersey.
Kay Larmer.
I'm Kay Larmer, representing the Drainsville District. I'm calling from my weekend house in Stafford.
Okay. Martha Cooper, you're muted.
Martha Cooper, representing the city of Falls Church, calling from my home in Falls Church.
Joe Hasty.
Joe Hasty, I'm the Providence District representative, and I'm at my home in Fairfax County.
Okay, Joe, maybe you need to sit a little closer to the computer there. I couldn't hear the beginning.
Again, I'm Joe Hasty, and I'm the representative from the Providence District, and I'm calling from my home in Fairfax County.
Excellent, thank you. Mike Perrell.
I am Mike Perrell, representing the Braddock District, calling from my home in the Braddock District.
Kathy Muha.
Kathy Muha, representing the Sully District, calling from my home in Bethany Beach.
Phyllis Palumbi.
I'm Phyllis Miller Palumbi, and I represent the Hunter Mill District, and I'm calling from my home in Reston, Virginia.
Okay, I think that's all of the commissioners I see at the moment. I'm going to ask other people, please, to turn off your cameras so that I can see all of the commissioners on the screen, because we have to ask Mike Perrell, our vice chair, to run the votes here. Here's my motion. I move that we have a quorum present via remote connection and that each member's voice can be adequately heard by each other member of the Fairfax Area Commission on Aging.
Is there a second for that motion?
I second.
See, Diane, I'm at several people. It's a tie. I'll go to Diane.
Okay, raise your hand.
Everybody in favor, say aye.
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 Opposed? Nay. Any abstentions? The motion passes.
Thank you, Mike. Second, having established that each member's voice can be heard by every other member, we must establish 4 points: the nature of the emergency that compels these emergency procedures, the fact that we are meeting electronically, what type of electronic communication is being used, and how we have arranged for public access to this meeting. Here is the motion. I move that the state of emergency caused by the COVID-19 pandemic makes it unsafe for the Fairfax Area Commission on Aging to physically assemble and unsafe for the public to physically attend any such meeting. and that therefore FOIA's usual procedures, which require the physical assembly of the Fairfax Area Commission on Aging and the physical presence of the public, cannot be implemented safely or practically. I further move that the Fairfax Area Commission on Aging may conduct this meeting electronically through a dedicated audio conferencing line, and that the public may access this meeting by calling toll-free 888-270-9936. Participant access code 231525. That's the motion.
Okay, is there a second for that motion? I see Martha's hand up. All in favor, say aye.
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 Opposed, say nay. Any abstentions? It passes. Also, Carolyn, I see Kathleen Hoyt who's joined us now. If you wanted to see if she can hear us and we can hear her.
Thank you. I'm looking here. Yes.
I'm here.
Kathy Hoyt, please give us your name, your district, and where you're calling from, and try to tip your camera so we can see you.
Yeah. Better?
Better.
Kathy Hoyt, Basin District, calling from my home in Alexandria.
Thank you. Okay, so finally, we have a final motion. I move that, as required, all of the matters on today's agenda address the emergency itself, are necessary for continuity in Fairfax County government, and/or are statutorily required or necessary to continue operations and the discharge of the Fairfax Area Commission on Aging's lawful purposes, duties, and responsibilities.
Is there a second for that motion? I see Sharon Dreyer's hand up. All in favor, say aye.
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 Opposed, say nay. No abstentions, I'm guessing, so the motion passes again.
Thank you very much, Mike. Okay. Hopefully that will be the last time we have to do this, but you never know. So now we've done our roll call. I want to welcome our guests and remind you please to stay muted and with your cameras off while we conduct our business. And I will call on those who are here to give a presentation. I welcome you and very happy to have you. I want to point out that we have a closed captioning provided today. You can access that by clicking on the CC button at the bottom of your screen or wherever you find your controls. There will be a public comment period. At that time, if you are here to make a public comment to the commission, please use the reactions button to raise your hand, and I will look for that and call on you. You can unmute and put on your camera for that period of time. Otherwise, if there are no comments, there's also a time at the end of the meeting for announcements, and that I would invite anyone from the public who has an announcement could also do it at that time. So next item is review of our agenda. I have one amendment to the agenda. We added late an update on NV Rides based on the presentation that was given at the NVAN meeting yesterday. And I want to move that up under old business because NV Rides is part of the 50+ Community Action Plan. So we'll put that in the commissioner updates at the end of old business. Does anyone else have to amend the agenda? I'd like to hear a motion to approve the agenda as amended. Anyone want to make a motion? Are you unmuted?
I'll make the motion.
Okay, and a second for that motion? Kay Larmer, and all in favor?
Aye.
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 Aye. If I can't hear you, raise your hand. Some of you are muted. Okay. Any opposed? Take your hand down. Any abstentions? Okay, the motion passes. The agenda is approved for today. Next is approval of the minutes from the May 19th, no, the June meeting. I actually have two things to correct on those minutes. On the second page of the minutes, it said Kathy Cole motioned that the amended minutes be approved and Kay Larmer seconded, but there were no amendments to the meeting, so we didn't need, perhaps we should say motion that the minutes of the May 19th meeting were approved. This is at our June meeting. Okay, so does anyone else have a correction for the minutes? These are the minutes, remember, from the June, what was our date, 15th, 16th? From the June 15th meeting. Okay, I hear no other amendments. Do I hear a motion to approve the minutes as amended?
I so move. I move that we approve the minutes as amended for June 15th, 16th, 15th,
15th, thank you.
16th.
Was it the 16th?
Yes, I'm looking at my calendar.
Thank you, because the draft minutes themselves say June 15th, so we will make that change as well. And a vote now to approve those minutes for June 16th as amended. And Martha has made that motion. Do I see a second? Raise your hand. Kathy Cole seconds. All in favor, please raise your hand or say aye. I mean, we got to.
Aye.
Okay, opposed? Any abstentions? No, the motion is carried. Okay, that takes care of our beginning business. This is now the public comment moment, so I'm looking to see if I have anyone. Let's see, gallery view, full screen. I don't see any hands raised, so I'm assuming we have no one who is present to give a public comment. But we'll look forward to that in the future. We do have a presentation today. Robin McLaughlin, who's with us, is Laughlin. Did I pronounce that right, Robin? You can turn on your camera and your microphone now.
Hi, McLaughlin, yes.
Good. Robin is the Director of Philanthropy at the Insight Memory Care Center here in Fairfax. And we know her. This is not her first time to visit us. She and Ruth Reagan of Goodwin House Bailey's Crossroads visited us back in the May of 2019 to promote the idea, to propose that the commission support a dementia-friendly Fairfax program here in our area. And now she's come, that did happen. It did come about. We were very excited, and they have been working hard, including during the pandemic time. And I should give a special nod to our Commissioner Diane Watson, who's been very involved in the trainings for that. So now I will invite Robin to bring us up to date on what's been happening, and welcome.
Thank you. I really appreciate it. It was a great opportunity to speak to you guys before. I know it was welcomed to talk about Dementia Friendly Fairfax. So I'm grateful. There's been a lot of movement since the last time we talked. So I am excited to give an update on where we are. And just as a recap for anyone else on there, I'll just introduce myself and introduce Dementia Friendly America, Fairfax as well, just so to get us all on the same page. So I'm Robin McLaughlin. I'm the Director of Philanthropy at Insight Memory Care Center. And I've been involved in the Dementia Friendly community initiatives since the start of it. So with Tony Reinhardt starting Dementia Friendly Herndon in 2017. And so, yeah, I'm really excited to talk about it. I think it's a great initiative. I think there's a ton of opportunity for dementia-friendly opportunities to grow and expand and to do different education opportunities within our community. So I am excited. So let me, and I also thank all of you again for everything that you have done over the last few years to get us where we are, really for Dementia-Friendly Fairfax that started in 2019. So with that, we can get started with the next slide. So just as a general overview, I know most of you are familiar with what Dementia Friendly Fairfax is and America is, but just so that we're all on the same page, let me just close this 1 second. That doesn't happen. Okay, sorry. So the Dementia Friendly America it's a national network of communities, of organizations and individuals working to ensure that communities across the US are equipped to support people living with dementia and their caregivers. So the movement started in 2015 through the White House Conference on Aging. And so working with that, being able to grow that, it is now a big initiative. It's housed through the National Association of Area Agency on Aging, so N4A, which I know you're all familiar. So that is exciting. And it's in so many other communities already, fastly growing. So there's over 120 dementia-friendly communities within the US. So and I'll get to what specifically are in Virginia as well. So next slide. So I think, again, these are things that you may know, but these are recent statistics that came out around our growing need and the importance of being able to support older Americans and people that are affected by any type of dementia. So more than 6 million Americans are living with Alzheimer's. By 2050, the number of people age 65 and older with Alzheimer's dementia is projected to reach 12.7 million. And specifically in Virginia, the projected number of people age 65 and older is expected to increase 26.7%. So it's growing, and Alzheimer's and dementia deaths have increased 16% during the COVID-19 pandemic, which I'm sure we all have some hard stories around that. And then in 2021, Alzheimer's and other dementias will cost the nation $355 billion. So more than 11 million Americans provide unpaid care for people with Alzheimer's and other dementias. So I know those are a lot of statistics you may be familiar with, but I bring those up just because it's a growing need, and it's not just us saying that or seeing it. There are numbers behind it, and programs need to be there and to be able to get our community where it needs to be able to support, especially where we are in Fairfax, to be able to support our caregivers and the people that have been affected. So next slide. Yep. So what is a dementia-friendly community? So it really is a grassroots initiative, and each community can make it what they want. So it can be housed, within different people and organizations, cities and things like that. So which is really great, because no two dementia-friendly communities are the same, but the benefit of all the dementia-friendly communities is there's a network, so we can share resources and we can collaborate, and it's not territorial. We're all trying to do the same thing and to work together towards this. So it really is a community mindset of coming together to help educate the community and provide more resources. So in Virginia, Leading Age is our state lead for dementia-friendly initiatives here. Next page. And speaking to that, it's not just, Dementia-Friendly Fairfax has been established. So, okay, so this action team has taken it on and they're going to do it. I think you guys understand that's not how it works. You have to get a lot of people together and partner together, and it takes an entire community, which this visual, I think, is a great representation of, really being able to not have people age in place, but be able to have people to go out in the community, be able to go to the bank, be able to go to restaurants, be able to go to the grocery store, take public transportation, and have it be in a place that is welcoming and adaptive to any needs that anyone with dementia would have. And so that's a huge endeavor. Fairfax is a huge county with lots of different businesses and organizations and services. So we're taking it one piece at a time. You can't do it all at once, even though sometimes I think we can do it all at once, but it takes one piece at a time. We want to do it well. And it's also sharing what we're doing, being able to get that word out. And I'll speak more about different ways to get involved and things like that. But this just really shows all of the our community and where we're trying to focus on to get people involved. So next slide. And so how Dementia Friendly works is really looking at different sectors. So that's the same thing as looking at a community, but targeting different sectors, providing specialized education for those sectors. The Dementia Friendly Herndon started with the restaurants and really did a great job of targeting 2 restaurants. One unfortunately closed during the pandemic, but Virginia Kitchen in Herndon is still a Dementia Friendly restaurant that's able to care for people and to provide that support, and understanding some of the changes they had to make in order to do that, making sure that there's there's good lighting, it's quiet, there's not distractions, that the menu is easy to read, things like that. And each community, each business, and how they sort of take that approach and how they're going to adapt to it is going to be different to each business and each restaurant as well. But making that effort and having it be a welcome environment is great. And I will tell you, for the those two restaurants, we did have secret shoppers that went in there pre-COVID, all of that, and the staff did an amazing job. So that was a good testament to the team that helped train them and the restaurants that took on that initiative to be dementia friendly. So there are all of these. There are several communities within our area that have targeted different areas, from providing police different training so that they understand how to respond and how to, sort of wait for people to respond and not just rapidly ask questions, things like that, to knowing which resources are there to be able to provide those resources, helping even in grocery stores would be a great place to do, and banks, that type of stuff. So being able to grow to all of these is the plan. Next page. So getting into where we are with Dementia Friendly Fairfax. So 2019, you guys helped us get launched and started, and then very soon after, there's a worldwide pandemic, and so we responded by meeting. The action team has set up monthly team meetings, and those teams switch virtually, and we continue to meet. So I think being able to share how we were doing, struggles we were having, ideas of where we should reach, people who weren't being reached, sort of that brainstorming and still coming together. We were able to do a lot of virtual trainings and information sessions. So you can see we trained over 330, which is probably more than that by now, but it's obviously over, but a lot of people virtually over that time period, which was amazing. And I give Diane and Allegra Jaffe a huge compliment for that, because they were a big part of getting that out there virtually and promoting it. Dementia Friendly Herndon had Tony Reinhardt had moved out of the area, so that one has merged with Dementia Friendly Fairfax, which I think is great because they have a wealth of knowledge within that initiative, and so we have taken them on. And one of the leader who started the restaurant initiative with Dementia Friendly Herndon is leading it for Dementia Friendly Fairfax now. So just that collaborative nature of coming together and still serving Herndon. We're still wrapping and supporting Herndon through all of this, but. Most recently, we have formed a restaurant committee and a faith initiative committee. So that's a subcommittee of our action team meeting once a month to look at targeted different restaurants and different faith communities to be able to provide trainings and to support them in what they need. The restaurant committee did just put out a press release last month, I think, or early this month, I think it was, I don't know which month we're in, but about seeking restaurants to be interested in it. And so we pushed that out. We'll see how it gets picked up, but we'll be doing a virtual event in October for the restaurants that are interested. We also have targeted lists, and we're taking input from anyone that has a suggestion for a restaurant that would fit. As you can imagine, not all restaurants are an ideal fit. Some of them just can't accommodate some of the needs that someone with dementia might have, but that's okay. There's other restaurants out there. So, and faith initiatives, I think, was another big one to be able to target, because they see a lot of people. And I think that switching virtually, and we talked a lot about the faith communities during the pandemic, and with them having to switch over and figure out how they were doing their own work as well, we felt now was a good time to reach out to them so that we can support them as well. So those two committees working really well. And so next slide. So the action team. So we have an action team of about 30 plus. We probably have about 10 to 15 people that attend our monthly meetings, which I think is great. And the action team has been growing over this year too, and more people can join and participate as well. And this sort of gives a representation of all the people that can be represented on the team. And again, being able to have diverse representation really helps us to be able to target different areas, being able to think of things that we didn't have, and have those connections to the community to make sure that we can expand and reach all of those sectors as well. So in taking it one piece at a time. pretty much all of the action team has some sort of level of training that they can provide. A lot of the training, so a lot of the action team members are able to be backups for trainings or do different trainings as well. So they are critical, and I think the action team gets a lot of the credit for everything that has happened and being able to move things forward. And I think it's an exciting group to be a part of because there's so much to do. And I think being able to do it with other people and to do it across sectors and things like that, I think has been a great opportunity for people to connect as well. So we have them. And then the next slide goes into the Virginia communities that we have. So there's 8 communities right now. All of them have different leads within them. We do also, for the Northern Virginia ones, Alexandria, Arlington, Fairfax, and Central Virginia, and then Leesburg, we do meet like about every other month just to come together on a quick call, just to share resources, see what people have needs with or challenges, things like that. So that has been helpful as well, just being able to share even a PowerPoint presentation that someone did for one sector to share it with a different group as well, or talking through ways to grow and all of that. So that is just another way that the groups are collaborating. There are state leads, as I said before. Leading Age is the lead for Virginia, and it's Melissa Andrews and George Worthington that are our state leads for Dementia Friendly Fairfax or for Virginia, really. So, okay, so the next slide goes into Dementia Friends. So Dementia Friends is another great resource that was started sort of internationally and has come over to the United States as a US initiative of Dementia Friendly America. And so it's a really initiative to get people to go through an information session and to become a dementia friend. And it's a very high level look at the world of someone with dementia and understanding what it is, with practical tools that are in there, examples and things like that. And it's a really great way for someone that has a lot of experience with dementia, but also doesn't have a lot of experience to go through to, sometimes it's a good reminder to some of those key messages to understand the impact that dementia has on people's lives, and also for people who have no experience with it to really get a little bit of a taste of what the impact is. And so there's it was an initiative to get to 100,000 dementia friends in the US. So that has been accomplished. They pushed that out in June. So that was a big push to increase that. And so we have done, and I say we, when it's not me really, it's Diane and Allegra did a lot of it, and a lot of the other action team members held a lot of information sessions. They're a great way to understand who we are as Dementia Friendly Fairfax, and also just understanding just a little bit more. The benefit of going through a Dementia Friends information session is to have an action at the end of it. What are you going to do? What are you going to do with that information? How are you going to change what you do, or how are you going to help people in your community who have dementia? Or if you interact with someone that has dementia, what action are you going to take? And so it's not just a training that they just walk away from. It should be something that they hold with themselves, and then they keep building on it. So the next slide will go into the 5 key messages for the Dementia Friends that are, so this is not an information session, but I think these messages are very key, and I felt they were relevant to share. So just to sort of get an understanding of what the information session does. But essentially, dementia is not a normal part of aging. Not everyone who grows old will develop dementia. Dementia is caused by disease of the brain. It's the most common is Alzheimer's. It is not about having memory problems. It can affect thinking and communication and doing day tasks. And it is possible to live well with dementia and have a good quality of life. I can speak very highly of that from my experience at Insight for the past 8+ years. Insight focuses on quality of life, and you can see that. You can, being able to target those other challenges, whether it's something outside of it, there's an infection or there's something that's irritating them, and being able to just focus on that quality of life, and people can have purpose and have a great experience for those, even with that diagnosis. And there's more to the person than the dementia. So people with dementia are, again, a valuable part of our community, can have purpose, can, here at Insight, we have volunteers, we have teachers, we have bosses, we have all sorts of things. So it's, there is still a lot to that person, especially in the early stage of a diagnosis. People are still able to do a lot of things, but there's also obviously that diagnosis, and it affects different things. So being able to understand it is a disease. And so helping people understand that. So those are the 5 key messages from the information session. And then the next slide, we'll just go through sort of the overarching how Dementia Friends works, because it is sort of that education component under Dementia Friendly. So there's a master trainer. So the master trainer is like the person who can train other people. So he trains, or she trains people to become champions. And those champions are able to train people to do the, to train the community to become Dementia Friends. So the master trainer provides about, I think it's an 8-hour training for people to become a Dementia Friend champion. And there are, should have looked this up, and I apologize, I forget how many people within the action team are champions, but it's a lot of people. We've been able to keep track of all the champions so that there is a real resource of champions that can do the information sessions and train the Dementia Friends. So that's that piece. And then the last piece I have is really how to get involved. So to the next slide is about joining the movement. And so we did, so there's 4 different ways here. So join an action team. So whether it's Fairfax, obviously. So, but yeah, I know a lot of people are here. So, attending a meeting under, it's a monthly meeting, being able to, and it's not just for anyone on this call, for anyone, that you talk to that might be interested in it, to be able to say that this is an opportunity to join the action team and get involved. It's not closed. It's an open meeting that people can attend, and very welcoming to other people. Attend a Dementia Friends information session. That's we have those held twice a month at minimum, starting this fiscal year. So those are on our website as well. Become a Dementia Friends champion, and so then you can go through that champion training, and you can provide that education as well. Those are good for some organizations that want to train their staff as well. And then become a Dementia Friendly business. And so that's a new thing that we're doing. Like we did the restaurants, obviously, but looking at other businesses. We've had home care agencies and assisted livings and things like that want to identify as Dementia Friendly. And so we, as the action team, are putting together that checklist and that pledge for those businesses to say, yes, I will commit to all of this and this, and then have that sort of vetted through the action team to say, yeah, we approve that this business has committed to becoming a Dementia Friend. And so that would be an annual commitment, and being able to re-up that and go through the specific sector training for that business. All of this information is most of all this information you can find online. So we did also launch the Dementia Friendly Fairfax website, so people can register for events. We can add to that website. So I think that's an exciting avenue to be able to have more people attend. So it's www.dffairfax.org. People can go there and register for any of the upcoming events that we have. And then the last slide, I think, is just questions and my contact information. I think that was high level. I am open to any questions. Hopefully that will give you a little bit of an update where we are. Hopefully you can tell I'm very excited about this. I think the work of the action team and all of that has been really great.
I'm going to call on commissioners for questions as they raise their hands, and I see Diane first.
And good presentation overall. When you mentioned about at least 2 sessions per month, I think we need to add the fact that since the website is going up, any of the other champions that are going to be doing informational sessions, the information for those sessions will be at that website. So it's not just the 2, it could be more at any given time.
Correct. Yeah. Added as they come in. Yep.
Okay, Mike, you had a question?
Yeah, two questions. One is, have you seen the movie The Father, which I just saw recently, about someone with dementia? And if so, what did you think they portrayed it correctly, and could dementia-friendly help in any way? And the other question is, why restaurants of all things? So many things they could need help. Why restaurants? What I didn't hear you mention on the restaurants was the menu, the items on the menu. I mean, there are some diets that have been in research now that have shown to improve cognitive skills, like versions of the Mediterranean diet. Anyway, that's two quick questions there.
Yeah, I have not seen the movie Father. I will add it to my movie list. I don't know how quickly I'll get to that though, but I will add to it. So I can't respond on that one specifically. Restaurants, I will say that I think it's one of those things that came out because it's a good place to take someone. If you're a caregiver, it feels normal to be able to. I think we all know we have not been able to go out to restaurants over the past year and a half. Going to a restaurant and having someone serve you is a nice, normal, comforting feel in some ways. So that is, I think, the reason why. But yes, to your point, yeah, I think all the sectors are important, and it was a decision by the action team that the restaurants were sort of that priority. So what was your other point?
Well, is part of what's being asked the restaurants is to improve their menus?
Yes, yeah. So that is part of it. As far as the diet and the food that is offered, we don't get into, sort of that Mediterranean diet or that type of stuff. We're not getting into that. I think there are different other education programs that we can offer to, sort of provide that understanding of how healthy eating can contribute to sort of brain health, that type of stuff. But we're not forcing that on the restaurants. Those are sort of those options. But yes, I think the menu, the recommendations are sort of having pictures and bigger words to be able to identify that. And so it is looking at each restaurant as well.
Thanks.
Okay, did you address the movie The Father?
Yes, I have not seen it, so I can't address it, unfortunately.
Okay.
I'm sorry.
Thank you. Kathy Cole, I see your hand up.
I've only raised my hand to respond to Mike. When I was a caregiver for my mother, the most favorite thing in the world to do was to go to a Friendly's restaurant. If you remember those, they're kind of moving away now. They aren't as around as many of them aren't as around, but they would have a menu that had pictures, and she could point to the hamburger and French fries, and she was able to order independently, and she loves hamburgers and French fries, and we would then be able to talk about whatever across the table. So restaurants to me are the most important thing to open up for the dementia-friendly training, because it was a lifesaver for me and for my mom.
Well, we might want to have a bigger restaurant initiative then, because the hearing impaired really don't enjoy many of the restaurants around here. So that would be something to add, maybe thinking ahead to shape, Carol.
Yeah.
And Kathy.
I'm going to apologize to our guests today. We don't take questions from our visitors, just from the commissioners. But I invite you, if we can show Robin's contact information again, and the website for DFF Fairfax, that perhaps you can address your question there. Diane, your hand is up again.
Yeah, Kathy essentially answered part of it. I wanted to stress the fact that at these informational sessions that Allegra and I have done, the idea was to provide information that might help people to understand somebody in their community that might have the diagnosis, but a large number of people were either just recently given a diagnosis and they were trying to find out some information. And also we had some caregivers that I guess they wanted to be validated that what they were doing was the best that they could do. And a couple of the little tips in the session sort of told them what they were doing correctly and what they weren't doing correctly. One of the biggest things that people were saying is when somebody was telling them something wrong or talking about a different period of time, they try to orient them to say, no, this is now. And one of the things that we're stressing is just go with their reality. Don't argue, because that just can escalate. So the information session does impart information, but we do get feedback from the people who are participating, and that helps others who are attending the session as well.
Joe, I see you.
Yeah, Robin, could you speak a little bit about Insight?
Yeah, are you familiar with us at all?
Just somewhat.
Yeah, so we're an adult day center for people with dementia. So we're a nonprofit. We've been around for 37 years. We provide care for people in all stages. So early stage programs, and then our day center is for the moderate to late stage. We have a higher staffing ratio than the state mandates. We have person-centered care. We have robust activities that provide engagement and interaction and socialization amongst the center. We provide meals and snacks throughout the day as well. We have nurses, social workers on staff, and CNAs in the day center to care for the staff, for the participants. The capacity of the day center is 60. We're up to 40 right now. So that's exciting. We had to shut our doors in March, and then we reopened on June 28th with 8 participants, and we have been slowly growing back up. We've been COVID-free this whole time. We have everyone is 100% vaccinated, staff and participants. Our other services are education programs and support programs for caregivers. So most of those are virtual right now, but it's all different free education and support programs. You can go on our website and see a lot of them, but different counseling programs as well, just to really be able to support the caregivers through this journey. We do provide free consultations as well for anyone.
So are you referred to by physicians, by doctors?
Yes, we are. Yeah. So I think one of our biggest challenges is no one knows that we exist and no one knows what an adult day center is. So we continue to do our outreach and marketing, and physicians are a great referral source for us. And we've been, that is a target for our outreach so that they can have our information and to provide that information to families that get the diagnosis.
Thanks.
Yep.
Kay Larmer.
I may have missed this because my internet is not very stable right now, but when you have your restaurants participate in this training, do they then do something with that information so patrons know it? Like, do you have a sign they put their window? Can they put it on their menu? I think that would make it so, and my experience in adult day healthcare, Mike, for example, with restaurants is not all we're friendly to people with dementia. The attitude changed as soon as you walked in with them. We used to take them out at Christmas time. And I made sure before I'd make a visit and I would talk to the owner about what our participants were like. And so because frequently they were not understanding, and so therefore the service wasn't very good. So those are my 2 comments actually, but I wondered, do you have any kind of sign that people businesses and restaurants can put in their windows saying dementia friendly?
Yes, yeah. So I apologize. I did miss that part. You didn't miss it. I did not say it. So we do have, it's like a window decal, cling, whatever you want to call it, that they can put on their door, wherever they want. It's also an image, so if they want to put it up on their website. The idea too is also to do a press release around it, to be able to let people know, because I think that is one of the things is people don't always know where to look. And putting it on the new Dementia Friendly Fairfax website, putting on our website, being able to share it as much as possible and making that information out there. So, but yes, yeah. So, but it's that follow-up too, because you also, I think in any business there's turnover, and it's that frontline staff that need to be continued to be trained, because they're the ones that that are going to have that interaction. Even if the owners and the managers understand it, it's making sure that there's that continuing education.
So Robin, to earn that decal for your business, someone has come into your restaurant to give you a training? Is that something the champions do?
Yep. Yeah. So we haven't done it yet during COVID. So yeah, they'll start doing them this fall. But yeah, I think it could be done virtually a little bit, but I really think it will be in person. I think going into the restaurant to be able to see what modifications and recommendations would have to be made, and that restaurant committee would be the ones to be able to make that sort of final approval that they have done it. We think they have committed to this, and they have pledged to be a dementia friendly restaurant.
I'm thinking I did the Dementia Friends training and I remember a lot of it, but I could probably use a refresher. But one of the things I remember that was discussed at that point was first responders. And I think Herndon maybe, or one of the other groups, Leesburg, was working with first responders. And I'm just wondering, there's such an enormous need. The statistics you gave us at the beginning, this is going to become only more widespread as more people age into the 65 plus category. Are we going to have enough trainers? Can we certify people to be community trainers that don't have to have, a psychology degree or whatever? What do you think? How can we do this?
Yeah, that's exactly the challenge is getting more people involved. I think when we initially started this initiative for Fairfax, it was looking at every district and having representation within each district. I think since we had to sort of pivot into COVID and we went virtually, we're just sort of working virtually through this atmosphere. But I think being able to adapt and change and to grow the action team and this initiative as needed to be able to reach as many. So so if we end up with 100 plus people that want to be involved in sort of the action team, we have to figure out what that meeting looks like and how to get people involved and growing and the organization of it. And so that's it's getting there. So hopefully will be a good problem to have soon. But it's getting a lot more people involved and doing more presentations like this, letting people know that we exist. The website, I think, is a great platform, getting more restaurants as a dementia friendly restaurant to be able to have that awareness as well. So people can walk into that restaurant and maybe we can have flyers at their restaurant as well. So people can pick that up to be able to bring it back to their boss at a business or something like that. Like, hey, we should do this as well. So it's that whole grassroots movement that, one person can't do alone. So we're, so I think coming here today is also helping to, sort of asking to help spread this as well. We did just reach out to all the Board of Supervisors to put a message in their e-newsletters that they send out about the upcoming information sessions to be able to get that out. So there will be a little blurb that will go out, whenever those emails go out, to be able to get more information out there and continuing to do more of that communication.
Kay, did you have something?
Just to add, I did complete that 911 initiative that just got put forward because of one of our commissioners, Tom Bash, who was relentless in getting it done. There is a place when you complete that to put dementia. So if you have a family member with dementia, you can go in and you can complete that form. And maybe you don't know about this yet, Robin, it's all pretty new. And it can have, so the first responders will be aware that this person has dementia.
Mhm.
And even to the degree of dementia, if you want to put that in there.
That is great. Yeah, I saw the announcement from Tom, but I didn't realize it had that component about the dementia. So I think that's great.
You have the
Something-
ability to put it in, yes.
Yeah, I think that's wonderful. Yeah, it's something we can help promote as well. Yeah.
So, yeah, I just wanted to close by saying I really felt a strong part of what Insight Memory Care does is the outreach, and especially to families with a new diagnosis. So there's a person who's just been told he or she has dementia, and then a spouse perhaps, or a son or daughter, someone who's going to be the primary person. I just feel that's enormously important to get connected as soon as possible, and to know that you're part of a larger community of people who are dealing with this. I would love to see more trained respite volunteers who could go into the home and help some of these caregivers. I think this last 16 months must have just been dreadful for both the people with dementia and the people trying to keep them healthy and happy and calm and functioning. So let us know what more we can do or we can promote in the way of respite care and paying attention to this. I think we have just a couple minutes. Are there any more questions from the commissioners? It's just, this is so important. It's going to be more and more. I'm involved in a steering committee now that's trying to establish a village program in the city of Fairfax. And two of the people who came to our first meeting told moving stories about their own. One of them is a volunteer at Insight Memory Care Center. And another one, his wife had dementia and passed away after 3 years. And so he went through the whole process with her. It's just, they both of them very strongly said there's going to be a tremendous need for this. We need everybody to be aware of it. So those are people, we're going to call on folks as soon as we get our village going. That's probably one of the first things we're going to do as a public event, is that one. So thank you very much, Robin, for coming today. We're excited to see everything you've been able to accomplish so far. And we look forward to being part of the future.
Of course.
All
Thank you
right.
so much for the opportunity. I really appreciate it.
Great, thank you. All right, that brings us to old business. And the first thing under old business is actually kind of a new business or extension of old business related to one of the most important aspects of the 50+ Community Action Plan, is transportation. And we have with us Cynthia Larico, who can unmute herself now and appear on screen. Hi, Cynthia.
Hi,
Welcome.
Carolyn. Hi,
Welcome.
everyone. Thank you.
So Cynthia was part of 50+ and reporting on that, and we've had some previous efforts. We had grants before, and now we're hoping to get a new one. So I wanted you to tell us a little bit about it. And I actually have a copy of the grant support letter that we submitted the last time around. So
Yes.
maybe we can work out some kind of a new version to help you.
Yes, we will be needing that hopefully in the next month or so. But yeah, thank you again for having me. Just again, I'm Cynthia Alarico, the mobility manager within Neighborhood and Community Services. Also on the call is my colleague, Mary Jo Hensler. So her and I work together. And I just wanted to give a brief update, try to wrap it up as quickly as possible. Some of the work that we've done with the mobility management unit, the work, just so everyone is aware and knows what mobility management is we support, coordinate, and enhance transportation specifically for older adults and those with disabilities in the county. The county has been receiving this funding from COG, the Metropolitan Washington Council of Governments, for the past 6 years now. So just wanted to highlight some of the work that we've done with our current grant that's actually about to wrap up and our new grant. So with the current grant, which is actually our second round of funding, what we've been able to do is some of our initiatives and goals were to enhance the call center within Human Services Transportation. That's the unit that we work from. So in the past year, we worked to streamline our phone system. Prior to us doing so, there were various phone numbers, various phone options. The HST call center could be very complicated and kind of giving the runaround to some of our callers. So we were really happy and excited to streamline the phone system to be more customer friendly, fewer and more transparent options. So I think that's really worked out. And part of that effort too was to cross-train our staff. We are a very small unit as far as HST, Human Services Transportation goes. We only have about 14 staff there, but we have about 5 or 6 different programs. So what we saw is that, some certain programs were working in silos. So we were able to cross-train staff so that when someone does call, they can connect them to all the programs and services that we work with. So currently, if you were to call our call center, our 3 main options right now are TOPS, which I'll talk about in a second. It's our new transportation subsidized program. We also have a taxi vaccine line, which I will share some of that work as well that we've done. And then if just folks have any other transportation issue or questions about our fast train service, that's the 3rd option. So our grant was focused on that. Another goal that we had was to enhance our travel training program. Unfortunately, a lot of these efforts were impacted by COVID and during the pandemic because of, limited access to public transportation and also just folks not interacting as much. We were finally able to launch it this past December. And the grant actually focused more on small groups versus a larger group. And those of you that are not familiar with travel training shows individuals how to use and access a public transportation system. Before, it was concentrated in certain parts of the county, so we wanted to make sure that we offered it throughout the county. It was very lengthy. It could be up to 6 hours. So we focused on small groups and also shorter amounts. That was a feedback, especially with older adults. A shorter time period was more doable. So we've done a few of those sessions. And this work will continue past the grant as well. The travel training program is going to stay within our unit, and then also we'll be focusing on just the regular population or those with limited incomes as well. Our other goal is also just to work to identify transportation gaps and barriers and to work with county agencies, community partners. And we were really, this is pivotal during the pandemic. So for the past year, Mary Jo, myself, and Jennifer Kinerick, we led a subcommittee that is part of the group called the CPST. It's the Community Provider Strategic Team. And this team was created in late March of last year. And it was to basically identify any gaps or barriers during the pandemic and bringing community and county resources together. There were 5 subcommittees as part of that, and transportation was one, and we led that group. We met on a monthly basis just to identify transportation issues. We were heavily involved with a lot of the food delivery programs and other transportation efforts as well during the pandemic. Also in the past year, Mary Jo and myself were heavily involved and essentially created the county's vaccine taxi access program. So in January and February, we started having conversations with the health department and also with other agencies, including the Department of Family Service as well, to identify transportation options and resources for older adults and those with disabilities who did not have transportation or access to their vaccine appointment. And this came about in almost like a week. We actually partnered with the county's taxi provider, our taxi provider's Old Dominion Transportation Group. They govern the taxi companies that operate in the county, and we were able to create a service. So it's a free taxi ride essentially for those that do not have any transportation to get to their vaccine appointment. And how that works is that the health department would screen the caller, and then they would do a transfer to our unit, and then we would coordinate and pay for the ride. So this is actually, at one point, I think April was our busiest month. We provided in April alone over 200 rides. But of course, as we see in the news, there's been a decline in vaccines. And right now we're getting a few requests a week. It's not overwhelming. But overall, since February 11th, we launched this service. We have provided 400 round trip rides, and over half of those was to older adults. So we're really excited about this service. It's continuing in the fiscal year too. So we're still working with the health department to receive these referrals and provide rides as well. Another exciting update is we finally launched TOPS. I think I may have shared this program with the committee, with the commission in the past. But TOPS is the new highly anticipated program that replaced the county's subsidized taxi voucher program. So as you may recall, we had 3 different taxi voucher programs. It was Seniors on the Go, Taxi Access, and Dial-A-Ride. Very, very complicated program, and we streamlined that all into one. And Mary Jo and myself, along with a small work group in our unit, we were part of the group that actually created, implemented, and finally launched the program. Some of you may recall, we were supposed to launch this July 1st last fiscal year of 2020, but our contractor, everything was impacted by the pandemic, but we were really happy and excited to announce that we finally launched this program early April. I think it was April 3rd was our go live date. And of course, our first 2 months, still even some now, we had some glitches as expected with any new program startup, but we're really excited about it. Everyone's been, we've been getting a lot of great feedback. And TOPS, the way it works is if you are an older adult on limited income, or just a normal person, a regular person with limited income, or someone with a disability, you could qualify for this. You would pay $20, and then the county would load $100 onto the card. And the great and more exciting thing about TOPS is that not only is it just one application, you can apply online, you can still apply with a paper application, but the great thing is that we've expanded the transportation options that are accepted in this program. So it's a Visa transportation debit card, and they can continue using it for the county's taxi services, but they can now also use it for Uber and Lyft. They have access to load money onto their WMATA Smart Trip card, which would link them to public transportation, provide access to that, or the Connector bus service, and WMATA Bus and Rail. And also it includes the county's bike share program. So we're really excited about that. And 2 modifications that we did with TOPS is that the prior age requirement with our taxi voucher program was 65 plus, and we actually lowered the age to be 50 plus to align it with the 50 plus community action plan. So we're really excited about that. And then for those with disabilities, we can also accept Social Security statements if they're receiving SSI or SSDI before, and Metro Access, but before it was just only Metro Access. And what we heard from the DSB and different communities they were saying that not every individual with a disability is a Metro Access rider, so we expanded that as well. We're also happy to announce that we hired recently, about a little over a month ago, a new TOPS program manager. So we hired Susan Shaw. So some of you may recall working with her. She actually used to be the previous mobility manager, but we're really happy about having her back in HST, and then also for her to manage the program. So lastly, we currently the county did receive a new cycle. So it's our 3rd round of COG funding to support our mobility management work as well. It just started this past May. Mary Jo and myself are working on some of these efforts, but we did receive from COG $75,000 to add to the TOPS budget. And what we're planning to do with that is to do outreach to some of these hard to reach older adults. And we're also kind of focusing on equity emphasis areas. So some of the seniors and those with disabilities in the Falls Church region, Bailey's Crossroads, and then also in the Richmond Highway Route 1 corridor area. So we'll be specifically doing some targeted outreach there to recruit additional TOPS participants. We're also going to be working with MV Rides and Data to kind of address the need of transportation for older adults and those with disabilities who are veterans. There's been a need around that as well, and we're hoping to see if it would be feasible to create a volunteer transportation organization supporting the veterans. So that is some of the goals that we have. And another thing too is just that a few years ago, we published a transportation resource guide, and we created an interactive GIS map. We're going to be updating that resource guide as well, as a lot of programs have changed and been updated. So we're hoping to update that either later this year or come early next year. The last thing on my agenda, and sorry, Carolyn, go ahead.
No, that's okay. This is an amazing list of things. I'm particularly excited about TOPS, the swipe card, right?
Yes, the swipe card. Yep.
Because it's been in the works for a long time. But you did ask to come on today to talk about the Federal Transit Administration's Enhanced Mobility of Seniors and Individuals with Disabilities program. So I don't want to run out of time before we get to what you want specifically our support for right now.
So and this is coming to my last agenda item here, is that, so right now, the new application, the new solicitation has opened, and this is due by September 1st. So we've been working, Mary Jo and myself, we've been working along with our senior management within NCS, but we're also hoping to hear from you or to hear from the commission, what are some transportation needs that we see, that you may see out there or have identified. Right now, we're just in the brainstorming process of what to apply for. So I know that's probably a pretty open conversation, and I can certainly, I want to, share my contact with everyone, and you can, feel free to reach out to me. But if there's something burning or an identified need, and I just yesterday told my division director that I was going to share this with you, but to please have that, to bring it to our attention, because we want to make sure that we apply for something that's actually needed in the county.
Okay. The letter that I have, and I didn't have time to send it out to everybody, it was a generic letter that we submitted in October of 2019 to Department of Neighborhood and Community Services, that we were supporting the grant application to the Metropolitan Washington Council of Governments. So at that time, you were looking for a grant to create affordable and sustainable transportation options for older adults and individuals with disabilities, to increase awareness of available transportation options by providing outreach and training to partners of the county and the community, and to increase community capacity with volunteer transportation programs. So I'm glad to hear that you have a connection with NV Rides, because they were really working hard, especially during the pandemic, and it was difficult to get drivers and, to follow protocols, and it took a while to get that up and running. But we're in a changing situation here. It's not clear whether normal modes of using transportation are going to come back or not.
No.
What do you know about the buses? I mean, what is this money for? That we're happy to support you getting money, but is it going to be to encourage people to go back to using public transportation, or
it could be. It could be that, it could be, a new pilot program. It could be a new transportation service. And this is actually what I mentioned to our directors yesterday or recently, is that, the grant that we just currently received was during a pandemic. So we had to really pivot some of those goals to align it to support in the pandemic. And the funding that we're applying for now, we're not going to receive it for another over 2 years. So it's hard to project to see what's going to be needed. What if another pandemic, or, what if we shut down again? Things could happen. So it's hard to predict what what we'll need in the future. But we do have to, it'll be just great just to gather some ideas of what could possibly be needed. Okay. And actually keeping the pandemic in mind as well.
I see hands up. Kathy Cole, do you have some ideas about where money could go?
Yes, I do. Where I live in the heart of Springfield, I have to walk a mile down a hill, up a hill, and then on a busy road without sidewalks to get to a bus stop. Now, thankfully, I'm still driving, but I intend to stay put as long as possible. So it's conceivable that I will not be driving through all that time. I have no way of getting down that hill, up the hill, and down the busy road. So the last, you hear talk about the last mile, but last mile is usually from a hub of transportation. This is from a bus stop. And I know that there were some pilot programs or experiments with driverless buses that would make a loop. So I would like that to be investigated, to get people maybe on a regular, just the thing just keeps moving, to get people to bus stops. The other point I want to make is that I live off of Old Keene Mill Road, and you guys have heard me talk about this before, but there's an assortment of lawn chairs at every bus stop up and down Old Keene Mill Road. And it is the most ridiculous thing I have ever seen. And I don't understand why there can't be a bench, because after I've walked up that hill and down that busy street, I'd have no place to sit to wait for the bus. So I don't understand, do I have to carry my own chair? I don't understand why we can't have a bench at every bus stop. So there's the other point.
Right.
Thank you for listening again.
No, thank you, Kathy. Those are great. That's a great idea. We are actually the circulator. It's what it's called micro transit model. We're exploring that too and seeing if we can leverage our fast trans to offer that in certain parts. So that's a pending idea too.
Okay, Kay?
Cynthia, fast train is expensive to run, a big van. So have you thought about looking into something, even a modified golf cart, something that's not going to be that expensive and it can use the dollar?
I think she froze.
Kay's frozen here. We lost her.
I know.
You're muted, Kay. You're back, but you're muted.
Okay. So have you thought about different types of vehicles than fast tran?
We have not. It's certainly an idea. But we can look into that as well. There are smaller fast trans that have smaller capacity that we would, could look at if we were to offer a micro transit model. The only issue with purchasing a vehicle is that with the county, it takes really long to the procurement process is lengthy, but it's certainly an idea and we can look into that.
And the other thing I wanted to ask you, it's about TOPS. I know that there were certain areas in the county that fast tran was not able to pick up participants for the adult day healthcare programs. Would TOPS be also a opportunity that they could use that to get to, and if they're able to get to and from the center that way?
Absolutely. The great thing about TOPS is it's flexible. It's, if you're eligible, if you qualify, you have $100 to use transportation as you wish. So that's some of the work that we'll be currently working on right now with our current grant, is identifying some of these hard hit areas or where there is a transportation need to make sure that they're aware of the program and that they apply for it.
Great, thank you.
I see Mary Jo has turned on her camera. Did you want to say something here? No, just you're participating, backing up Cynthia. Okay. Yeah, this $100 card, how often can you re-up on that? Can you reload it?
So currently right now it is only twice a year, and we have gotten a lot of feedback on that. We are hoping and we're looking at seeing if, because we had some additional funding, it's not guaranteed, but we are looking to see if we can expand that to, additional, to provide additional subsidies to participants, because, $100 can be used rather quickly.
Yeah. And as far as disabilities go, I understand that Lyft was doing some training or identifying riders who could handle wheelchairs or people who had special needs for rides. Do you know about that?
I haven't heard about Lyft's efforts, but I've heard about Uber. Uber offers it in the Washington area, Arlington and City of Alexandria. And it's not, when you pull up the app and if you request a wheelchair accessible Uber, it says one isn't available. So it's not provided right now in the county. So what we have done to address that is that we would refer them to use a wheelchair accessible cab.
I'm not seeing any other hands. This is a federal grant you're applying for, and there's a deadline you said in September. What's the date?
September 1st.
Oh, but we don't meet
September
again. But we don't have a specific proposal in front of us. I understand. My husband grew up in a Navy family. His dad always said, if they open up a pay line, get in it. So the feds have opened up a pay line for some money for you. And it seems like you have a lot of things you could spend it on. The one thing that concerns me about a pilot program is that it ends. There was a bus pilot program that a lot of people were using a couple of years ago as part of the 50+ plan. I remember hearing about it, that it was a summer program, maybe a 6-week program that I'm not remembering all the details, but people were using it and then the money ran out and that was the end of it. And that's almost worse than not doing something in the first place.
Yeah.
So I hope, this would go into something that would have long-term lasting effects for residents here. I don't know, commissioners, I don't have a draft letter. The one that we had before was had some boilerplate about the need for accessible and affordable transportation for older adults and individuals with disabilities. I just don't know, how do you all feel about, they're very open-ended about applying for these federal monies? Anybody? Commissioners? Raise your hand or unmute yourself. Sharon, I see you.
Well, I think because the issue is so big and overwhelming, we ought to apply for whatever funds there is and use as creative writing as we can about unmet needs, or, I mean, surely there are some creative writers among us that could come up with something. I just think it's unfortunate not to apply for money that won't be available for 2 years. So we got to apply. We got to endorse them somehow.
We'll be
Okay,
applying. We'll certainly be applying. It's a complete application is expected by my director.
Right.
But those, even what's identified in the
Diane, do you
letter.
wanna add something?
Oh, sorry. It's more of, those are like the overarching issues, and there's then more specific programs. So
Right.
by the time that we actually, probably in 2 weeks, we can have something a little bit more solid that we can share and identify in a draft letter of support. But
we don't meet in August, is that correct?
We do not meet in August, so if we're
Oh.
going to approve something, we have to do it today. I mean, I can just say, on behalf of the Fairfax Area Commission on Aging, it is my pleasure to write a letter in support of, and this would be directly from the Human Services Transportation Department. Is that who's applying, or who's applying?
correct, it's NCS, Neighborhood and Community Services, Human Services Transportation.
Okay, so it, like the last one, it would then be the Department of Neighborhood and Community Services, Human Services Transportation
Correct.
Department. Application to the Federal Transit Administration, what it says.
Correct, yeah.
And then just this paragraph about accessible and affordable transportation being a critical need, that access to mobility options was an important part of the 2014 50+ Community Action Plan. It will remain a focus in the proposed, it said 2020, but we don't have that date anymore. So the proposed Shape the Future of Aging plan. Transportation promotes independence, and the ability to maintain mobility enables people to age in place in their communities. And then just skip over the listing of what the grant is intended for at this moment, because we can't do that. But we fully support the efforts of Fairfax County and look forward to working with you and participating in efforts that meet the needs of older adults and people with disabilities. So if that will help you, it's very generic, but I think we could probably, does everyone feel comfortable about a letter similar to the one that we did in October 23rd, just leaving out the bulleted list of what the specific use of the money would be? Are we okay with that?
I'd make that as a motion.
Okay, Sharon makes a motion that we submit a letter of support for the Department of Neighborhood and Community Services, Human Services Transportation to apply for this grant from the Federal Transit Administration. So we'll just sub in those names for the correct thing, and I can send that in. Okay,
Awesome.
so there's a motion. Do I hear a second for the motion?
I'll second it.
Phyllis, okay. All in favor, raise your hand and say aye. Raise your hand.
Aye.
Aye.
Any opposed? I don't see any abstentions. Okay, the motion passes for you, Cynthia. We'll give you a letter of support for whatever you want to do with these monies you get.
It'll be good, I promise. Thank you, and the support is much appreciated. Thank you. Thank you very much.
We know you'll come back and tell us what you're going to do. So, good.
Yes.
Okay, folks, we're running behind schedule. Let's move along now to the updated remote participation policy on which we need to take a vote. Jackie, are you going to say something about this?
I can, and I will keep it quick. I have been receiving the question Tom just asked, but of course, everyone's been asking, when will you meet again in person, right? And the answer is we don't know. So just quickly to remind you that during COVID, we have been living under 3 orders that affect your meetings. the governor's state of emergency, the local state of emergency that the board put into place, and then an infection disease control, which is the state restriction on meetings and social distancing within meetings. So the governor has lifted his order, but the board has not yet lifted their local order, and the infection disease control order is still in place as well. So when we know, we will let you know. Hilda, of course, has been taking care of you, and she's trying to arrange for possible in-person meeting places, but we don't know what that means yet. If the board lifts its local order and we still have to have social distancing in place, it could get tricky, right? But of course, this whole electronic meeting versus remote participation meeting is confusing. The county attorneys have acknowledged that. Staff has been confused. You all are probably confused if you think about it at all. So I will just give you the quick mnemonic that the county attorney taught to the back support staff, and then I'll comment on the remote policy and turn it over to you all. So the county attorneys told us that E stands for emergency, and E stands for electronic meeting. So that's what you're doing right now. You're meeting electronically. Once the emergency goes away in Fairfax County, you can't meet electronically anymore. No more E. So then we go to P, and P stands for several things. P stands for in-person meetings. P stands for, let me see what the second P, it stands for a physical quorum present, and it stands for remote participation. So if you want to, once the state of emergency is lifted in Fairfax County, as a public body, you need to assemble an in-person quorum. And some of you, according to this remote participation policy, have the option to meet remotely. But in order to hold a meeting, you have to have a quorum, which according to your bylaws is 5. So we will work all of that out. But right now, what you have to do is to vote to approve this amended remote participation policy so that you'll be ready when we meet in person again. And I don't remember if Carolyn said it in the meeting, but we've talked about it before. This is almost a formality, your vote, because the language was drafted by the county attorney's office very carefully, and they've told all of the boards, authorities, and commissions that you really need to use this language. They based it on the new legislation. So if you would please vote on that, and then trust me that we will all work through it together, and I will try to provide you clear guidance when we can meet together again, how we will do it, where we will do it, all of the details. I can say more now if you want, Carolyn, but I don't think you need more on the details right now.
We all, it was in our packet, a copy of the draft, and you saw it with the new language in red, so you could see it was complex, and you know, we had a number of concerns about it, but frankly, I'm hoping we won't need to apply that, because perhaps the General Assembly might consider broadening public access by remote meetings by remote access. It's made it possible for a lot of people to participate in meetings who couldn't do that before because they couldn't get to them. So, but it, you know, even for our commissioners to be able to call in and participate, we're not going to have a Zoom contact in the future when we're meeting in person. We've tried before occasionally with a telephone, and we've not been able to meet that standard of being audible to everybody. So I think what we need to do now is just vote on this and approve it, because it's probably not going to be applicable to us for a while, and maybe there'll be some changes eventually. Sharon, did you want to say something?
I just wanted to say, rather than beat a dead horse, if we have no control and we have to do this time, let's do it, and then we'll deal with whatever, whenever. But let's vote and do it and get it over with and move on.
So who would like to make a motion?
Make a motion that
approve the updated remote participation policy.
So move.
And a second?
I second it.
All in favor? Raise your
Aye.
hand,
Aye.
say
Aye.
aye. All opposed? Any abstentions? The motion passes. Okay, Healthcare Advisory Board Legislative Position on Long-Term Care Staffing. This is actually a follow-on to a motion that we had last time to say that we generally agreed with the Healthcare Advisory Board that, long-term care staffing was inadequate, underpaid, needed more training, needed more time off. It was a very general thing that we had been asked to do, and we did have a motion, but Mike perhaps quite rightly abstained because, or no, he voted against it because he felt, we needed more details. So what we got this week was more details, quite a lot more details. The only good thing about the fact that we voted to say that we were in general support last week was that Jackie was then able to participate in the drafting of the 4-page, very detailed proposal that we saw. So at this point, is there any discussion about that? Does anybody want to talk about it? You saw more. Mike wants to say something.
Okay, so I guess what's new to me about this that makes me worry about the so-called law of unintended consequences is that depending on how this kind of thing gets approved and applied, you may actually be hurting residents by hurting the workers by having them replaced by robotic technology that is now moving very fast in terms of both monitoring people in nursing homes and actually helping them in various ways. Japan is, from my little bit of research, is leading the way. So, I'm wondering, is this something that might have been good idea 10 or 15 years ago, but it's not, it's too narrowing in terms of its focus, that's all.
All right, does anybody want to respond to that? I don't know, Mike.
Well, I'll let Kay can.
Yeah, Jackie.
Well, I think Kay was going to respond to that, and then I'm just going to provide a little bit of context, but I defer to Kay. If she hasn't frozen, it looks like maybe she froze.
Okay, we can't see you now.
I'm on the video. I can see you all.
Okay,
Hear
well,
me?
you're I can barely
I'm-
hear you. You show up as muted on my screen. I don't know.
No, it says. Can you hear me?
You're broken up.
Sorry. Yeah.
Maybe while Kay's trying to restore her voice, I'll say just really briefly a reminder about the purpose that this position paper serves. And it is simply to allow the Board of Supervisors to approve a particular broad position and therefore then to respond with support on legislative bills that might come through. So, if no legislative bills come through related to this, then they won't take a stand. If bills come through addressing some of the robotic, good or bad, that Mike's talking about, that could be addressed separately, but it really is just to allow the option of support for this. And I guess that's all I'll say, because I think Kay's back.
The motion that I would be looking for here is simply to add the name of the Fairfax Area Commission on Aging to the list of possible support or opposition by organizations. So to the list of supporting organizations. If this is talking about people who are currently working in the field who are going to have better working conditions, I don't know that they're going to feel supported by us saying, well, we don't want a robot to take your job, so we aren't going to support this. Maybe we just have to put it for a vote. Kay, are you able to speak in now? You have to unmute yourself.
Can you hear me?
Yes.
Okay, Mike, you know what? The robotics and the monitoring, it's going to occur anyway, no matter what happens. And I think the more we can support the workers today, and in any way will raise the level of what they will be paid even when the robots are there. So I think we have to look at this like, you know, nursing homes are in a business to make money. And so therefore, if there's going to be something cheaper for them to use like a robot, they're going to get it. In the meantime, let's really support these workers who have been in desperate need of support for many years.
So I thought the motion is to add more staffing, not so much to give the workers enough pay, which is fine, but.
Well, I think it's also to increase the staff ratio. One of the biggest problems has always been a lack of staff of their, you know, they could have one aide for 10 nursing home patients, and that's certainly not something anybody can take care of and do a good job.
So the state's going to dictate how many people, and it's not just, of course, it's different types of support in nursing homes, you know, ranging from aides to registered nurses and, you know, everything in between. So I don't know, it just seems like a little bit of overreach with this approach. So I think I'll move from object to abstain until I get much more enlightened than I currently am, if we're going to vote.
The actual proposal is to support legislation that would amend 32.1-127 of the Code of Virginia to increase direct care staffing levels for long-term care to ensure better health outcomes and quality of care for medically frail individuals, including older adults and individuals with disabilities. So that's the proposal, and we would be adding the name of our commission to the list of supporting organizations.
And Carolyn, if I may, I'm not exactly sure where the Commission on Aging will be inserted, because this will be submitted as a board statement. So you will be listed with the Healthcare Advisory Board. And I'm sorry, I'm not sure exactly where that is, but the spirit of what you said is certainly
Okay.
what would happen.
Just add us to the list of supporting aging and disability groups at the end of this document. So do I have a motion to that effect? Kay, do you want to make the motion?
So moved, yes.
Okay, and a second from Sharon. Okay, we'll have a vote then. All in favor, say aye or raise your hand. Count
Aye.
2, 3.
Aye.
Okay, opposed, say nay. Abstention.
So I'll go abstain.
Mike has abstained. Okay, so the vote is 11-1, or 11 in favor and 1 abstention. And that motion passes. We're running time rapidly than expected. Commissioner updates. No, we're already late. I'm going to ask, I don't want to keep TB here any longer than she needs to be. So Tara is not well today. And so our director's report is going to be presented by TB Nagasi, the program manager for adult services and adult protection services. TB, welcome. And thank you for being here today.
Thank you for having me. I wanted to just convey that Tara is able to be here today. She did have a couple things she wanted you to know. It was announced yesterday that the Fairfax Area Agency on Aging's Fairfax Caregiver Alert Notifications Program is the second place winner of the 2021 National Association of Area Agencies on Aging Innovations Award. There were so many thank you. I'm thanking you on behalf of Tara, because this work was really the product of the program that Juliana Valencia specifically runs, our caregiver specialist. And there were so many innovative and creative things happening across the country. Absolutely to have been nominated, no less placed second for the award. So Tara wanted to recognize Valencia for her innovation and hard work with regards to this project that serves over 700 family caregivers. The second item was related to Tara wanting to convey how much she missed this meeting, because she wanted to personally thank Carolyn, Mike, and Kathy Muha for the leadership role they have played on the Commission on Aging. And I'm going to turn it over to Jackie, who's going to provide Tara's statement in her absence. Thank you.
So as TV said, Tara really wanted to thank you three, the triumvirate, right? The current officers. Kathy Muha for so laudably serving in the role of the first ever COA secretary, producing accurate, well-written minutes that provide a record of the excellent work of the COA. And also for Kathy's work with our AAA dietitian, Maria Lowe, on food insecurity, and her commitment to end-of-life conversations. And also a special thanks to Kathy for her beautiful virtual Family Caregivers Month proclamation remarks this year, or last November. And then to Vice Chair Mike Perrell, Tara wants to convey thanks for your creative, thought-provoking, and always entertaining ways, your insightful input on data and surveys, your work on scams, home sharing, empathetic parking, technology, COVID response, film club now, and of course, pickleball, and your representation and annual chairing of NVAN meetings. You did an excellent job with that yesterday. I've heard from several. And her thanks and our thanks for your multiple presentations, including your, again, creative remarks for this year's Older Americans Month proclamation. And then to our chair, Carolyn. Tara and I and the AAA thank you for understanding how community engagement and government processes work together to advance initiatives. Your encouragement of commissioner participation on county and regional committee and committee efforts, and then your own visibility in the city of Fairfax, including your service on several city council work groups related to affordable and accessible housing. We thank you for your impressive handling of the 50+ Community Action Plan final report before the Board of Supervisors. And you all remember that this included Carolyn's vision for you commissioners to interview community champions to provide first-person reporting of successes and recommendations for future improvements. And of course, we've all been incredibly grateful for Carolyn's stellar writing skills and public speaking skills in public budget testimonies, community engagement, presentations before the Fairfax County Board of Supervisors. So on behalf of Tara and the AAA, we thank you three for your leadership and service to the Commission on Aging and to older adults in Fairfax County and the cities of Fairfax and Falls Church. Thank you all. And bravo. Job well done.
And it's not quite done yet. We have a little more meeting to get to. So thank you all. Updates I've skipped over, but I want to go back to because Tom has an important update that we all know about, but I wanted to give him his moment on screen. Tom?
Oh, okay. Thank you very much, all. I did send you an announcement a couple days ago. We have had a great success. Just a couple days ago, the Fairfax County government approved pre-notification 911 for the county. This is something which was part of the 50+ plan. I've been working on this for 5 or 6 years, I guess now. I think it's very important. It will help a lot of people. Basically, I'll tell you in a few minutes why it's important. You may know that when you call 911 or the police department or the fire department, they arrive at your house and they know absolutely nothing about you or the people inside your home. There might be a person who is deaf or blind or in a wheelchair or has Alzheimer's, a child with autism, who, when he or she hears the siren, might run out of the house and confront the police officer. And that has caused a problem in Virginia and in other states. So basically, the more that the rescuer knows about what the situation is when he or she arrives at the home, that is helpful, I would think. So in the past, we had something called the File of Life.
Right.
And you could hang this on your refrigerator door along with pictures of your kids or your grandchildren, or your dog, and it's very hard to find. And it was a very 20th century solution. We also had something called the Yellow Dot Program. And you could put this in your car, telling that you have special medical needs. But this is a completely 21st century thing. There are perhaps 3,000 communities on this program in the US. DC, Alexandria, Prince William County are on this program. And finally, Fairfax has agreed to go on it as well. So I'm very happy about this. I hope you all visit the site at the DPSC webpage. And if you have a disability or even a contact, if you call 911 and the person arrives, you're an older adult, there may be no contact information. And this allows you to provide the police department or the fire department or the EMT to contact your relatives and saying, Tom, we found him, he has a heart attack or whatever, and you should know about this. My children or my nieces or whatever may live in California. They have no idea of this. So it's a communications tool. I think it will help a lot of folks. It's not perfect. Mike always finds a few things that don't work with this, but it's much, much better than what we have now. And so any questions you have?
We offer our congratulations for your commitment and hard work to make this happen. This is part of the 50+ Community Action Plan in 2014. So
Correct.
It's a while, but it's finally coming to fruition. And I'm sure you'll keep us up to date as it evolves and there are more instructions for how people can find out about it. Mike, I think you had something to say about NB Rides.
Well, I guess very quickly, the NB Rides Marketing Communications Director gave a presentation at the NBA meeting yesterday to kind of update on their status and how they've managed during the pandemic and some of the challenges going forward, such as trying to get more drivers to help out. And but the other thing, just to briefly mention, the director of NB Rides, Jennifer Kanarick, and Rachel Simon, the marketing communications person, are both leaving NB Rides. Those were the two permanent positions. Jennifer, grew the program from when it started. So she's done an amazing job helping all the local volunteer driving programs get going and giving them support. So the Jewish Community Center of Northern Virginia is trying to think through, are they going to just replace these staffs one-on-one or think of some other way to organize it. But they do have funding support from Washington Council of Governments as well as Fairfax County that I know of, maybe something else. And I can send people if they want the presentation that was given at the NBA meeting yesterday.
Yeah, that would be good to have the PowerPoint from yesterday.
Yeah.
Thank you. I see, I'm gonna just mention something very quickly I had from an update. The news that Little River Glen Senior Center has earned a platinum level Sage Care credential for LGBT inclusive services and culturally competent care. SAGE, which is an acronym for Services and Advocacy for GLBT Elders. They had to change it around to get the G in there. SAGE assists senior care agencies nationwide in creating inclusive services for this population to number 7 million by 2030. It was about a several month training process for the Little River Gun staff that included first person accounts from LGBT elders and learning how to identify and address bias and making environments safe and welcoming. And the NCS plans to ensure that all county senior centers will urge the SAGE Care credential over the next year or so. So I want to go now to new business unless anybody else has an update very quickly, because we have Teresa Brown who's here waiting to talk to us about the area plan budget waiver. So Kay, you have something real quick?
Yes, real quick. I think that the 911 pre-notification.
Oh, we lost her. Can you get back on, Kay?
Can you hear me now?
I can hear you, I can't see you, but go ahead.
I'm thinking it's important enough for maybe an article to be sent to all the board members about it, to be included in their newsletter. Can you hear me?
Yes.
I'm sorry. Yeah.
We
Can you hear
heard you,
me?
Kay.
Okay,
Yes.
good. I think I went to send it on to John the other day and I went, no, you know what? They all should know about this. It's really a very, I think, important, something that is going to help seniors and a lot of people. So I think people should be notified.
About the LGBT training, is that what she's talking about?
The 911, I think she was talking about.
The 911, okay. I'm sorry. I didn't get the beginning of that. Let's talk about it next time, okay?
I'll see, you know what, I'll send you.
Teresa time here.
Martha has something to say.
Martha?
No, it was just about wondering about the 911. I assume it does not apply to Arlington and City of Falls Church yet.
Oh, it does. I asked Tom that very question. I don't know about Arlington, but the cities of Fairfax and Falls Church are part of the Fairfax County
Yes.
emergency system.
It does apply to the cities of Fairfax and Falls Church.
Thank you.
Okay. I'm sorry, Kay. The difficulties we're having, I'm having a little trouble too at this end. But I do want to get to Teresa Brown, who's just going to quickly say something to us about the area plan.
Hi, everyone. Good afternoon. It's
Hi,
nice.
Teresa.
It's nice to see familiar faces that I haven't seen in a while. So currently I am in the role of acting quality assurance manager. Many of you know me from being in Volunteer Solutions. So that's why I'm presenting on the area plan. And this won't take very long because it's just about the updates on the area plan. A little bit of background is that the area plan is a contract between DARS and the Department of Aging and Rehabilitative Services and the Area Agency on Aging for planned services provided to the Fairfax area. A comprehensive area plan is developed by the AAA and approved by DARS every 4 years with annual updates in between. So we are currently entering year 3. So there's only annual updates. It's only updates this year. It's not a comprehensive plan. The funding is generally flat each year, and therefore the projected person served and projected units to be provided are similar from year to year with modest changes based on client utilization. Service categories are usually unchanged unless there's new funding that's received. We do have a couple new categories this year. For the upcoming program year, we are adding the chore category, and this category will provide for heavy housekeeping and yard work, which we weren't able to provide before. Also things such as snow removal and items that we didn't have the capacity to provide before. So we're excited to be able to offer that to clients now. Thanks to the ACL 2021 Falls Prevention Grant, ElderLink is adding 2 new programs under Falls Prevention, and that's Walk with Ease and Bingo Size. And then home delivered meals, as you may have heard, is transitioning to a vendor delivery model from a volunteer delivery model. And that will decrease our count of volunteers for the Volunteer Solutions Program, but hopefully not by much, because we are going to try to accommodate volunteers and clients on the social component and well-being from Meals on Wheels that they usually receive from volunteers visiting, by adding lunch companion volunteers and social visiting volunteers to those Meals on Wheels clients who wish to have that type of social interaction. And the positive of that will be that those volunteers won't be in a time crunch when they're visiting those clients. They won't be rushing to deliver the next meal, where they can actually sit and chat and socialize and converse with the client a little longer. The last thing is we will now provide nutrition education in addition to nutrition counseling. And that will be for both the home delivered meals and the congregate meals programs. So those are the changes that are coming up for fiscal year 2022. And that's basically all I have to report on that, unless somebody has, or anybody has questions.
Diane?
I heard Tara give the remarks about the change in the Meals on Wheels distribution, going from the 3 days when you had people volunteering to the vendor delivery. I've since heard somebody say that there was some difficulty incorporating the 1 week meal delivery with their own family meals of other people. Do you have an option of possibly a 2-day delivery if they can't accommodate their meals in 1 day, or if they can't have all their meals incorporated in a refrigerator and freezer and still have room for the other people of their household?
I have not heard that they're doing anything but the 1-day delivery. That's not to say that they're not, going to adapt as we continue or start to get people, having different issues with the 1-day delivery. But as of now, I'm only aware of it just being the 1 day.
Okay.
Are there any other questions?
I'd like to provide a little input if it's okay.
Phoebe, do you want to turn on your camera and your?
Yes, I just wanted to encourage Diane for you to have the individual that you were speaking about to contact their Meals on Wheels worker to kind of talk through some of the concerns that they're expressing and see what accommodations might be made.
Okay, TB, thank you.
Was there any action item, Teresa, for this? This is a wonderful report, and we're really happy to hear about the additional home maintenance services that you mentioned. I think that's really important for a lot.
Thank you.
But if there is no action item, then I will move on.
No action item, just informative.
Okay, great. Thank you so
you.
much.
You're welcome.
All right, the one remaining item, and I won't spend any time, but go right to, I hope, Joe Hasty, who has been our senior member to administer the elections every year for the commission. And would you be willing to do that again today, Joe?
Yeah, I thought we already did that.
No, we didn't have the election. It's the last thing on the agenda. And we have a slate, our slate of new officers. Jackie, do you give this or do I?
Does it make you feel uncomfortable to give it?
Well, not
It
really.
shouldn't by this time.
Not really. I mean, I've had a chance to say thank you in the email that I sent out, and I certainly appreciated the very kind remarks that Tara shared with us this evening through you, Jackie, and for Mike and Kathy and me. It's been a pleasure to do this job. And now I'm happy to introduce the slate of officers who would begin in September. For chair of the commission, Kathy Cole. For vice chair, Kathy Muha. And for secretary, your continuing Carolyn editorship here. I will be on the slate for secretary. And Kathy Muha, I will talk to you about how it's been working for you, and you can give me some pointers. So Joe, would you like to call the election here for that slate?
Sure. open for nominations and a motion to elect the slate that we've selected, that we so mentioned. Anyone?
I move that we accept the slate as mentioned.
Do we have a second?
Second.
Martha Cooper seconds. All in favor of electing the slate of officers that have been mentioned, please indicate by saying aye or raise your hands.
Aye.
Aye.
And congratulations to our new set of officers.
Any
While I have the floor, let me thank Carolyn for her leadership and her excellent support for the COA during her chairmanship.
Joe.
Can I say something?
Yes, Kathy, congratulations.
Yeah, I think the thing is, be careful what you wish for. I just wanted to also add my thanks to Carolyn and to Mike for their amazing guidance. I know that Kathy and I probably feel like we've got enormous shoes to fill here. But I just kind of wanted to start the year a little bit by saying that we're going to be challenged next year. Carolyn sent out a very thoughtful and insightful email to us all about what we were facing coming up in the next year. And I don't want to lose our North Star that Carolyn and Mike have put out there for us. And without a community action plan or the pandemic response, while we still have them, we don't have a real specific plan to work on. But we all came to the commission with some concerns, with interests. We all came here for a reason. And I think if we could revisit those reasons that we all wanted to be on the commission, that perhaps we could put together an interim plan that kind of fit with the community action plan that we moved away from to do the pandemic plan, the response plan, and fit it all together in September. So, we don't have a meeting next month, but if we could think about why we all wanted to be commissioners and come up with the interests that we had in the beginning and see if we can't puzzle together something for the coming year or even two. And thankfully, Karen and Mike will still be on the commission to work with us. And I'm really excited, I think, to work with you all. So there we go.
There we have our assignment from our new chair for over the summer. I hope everybody has a wonderful vacation. The last item is just announcements. Does anyone have anything for an announcement? Raise your hand, wave at me. Nothing coming up?
I'd say, I wasn't going to say anymore, but we may talk about think tank in September. Oh,
was there a winner?
We have a project which I am not at liberty to discuss, and we probably won't meet before the big announcement. But the big announcement will be in September at the Board of Supervisors meeting. So stay tuned.
Nice way to start your new administration. Okay, if there's no further business, Diane?
I just want to say I'll be sending a flyer out about a dementia-friendly information session on the 29th. I'll send a flyer to you all.
July?
Yes.
All right. Anybody else? Okay, if there's no further business, I will entertain a motion to adjourn.
I move that we adjourn the meeting.
And a second for that motion? All in favor?
Aye.
Aye.
Opposed? We are adjourned. Thank you all. Have a good summer. See you in September.
Thank you, Carolyn. Thank you.
Thank you all, Carolyn, Mike, Kathy.